name's Alyssa. I'm going to be your student nurse for today. I'm going to go ahead and do a head-to-toe assessment video. It's going to take about 10 minutes. Is that okay?
Mm-hmm.
Alright. I'm going to go ahead and pull this curtain back for privacy and perform some hand hygiene. Do you know your name and date of birth?
Jordan Schick, 6/22/98.
Alright. I'm going to go ahead and verify that. Beautiful. Now could you tell me the date?
June 9th, 2020.
And the president?
Donald Trump.
Perfect. Now I'm going to go ahead and say that your speech is clear, posture is erect, hygiene is good, and clothing is adequate. Now I'm going to go ahead and start with the assessment, starting with your scalp, looking for any lesions, bumps. I don't see any, no parasites. Hair distribution is appropriate for age. Now I'm going to go ahead and move on to your eyes, so if you could just look at me. No redness, no discharge. Pupils are dilating at the same time. So I'm going to go ahead and have you look at my nose here and then look at the light. Nose, light. Alright. Pupils are equal, round, and reactive to light and accommodating. I'm going to go ahead and assess your vision, I guess. If you could cover your right eye. And then tell me when you see my fingers.
Yep. Yep. Yep.
Perfect. And switch.
Yep. Yep. Yep.
Perfect. Cranial nerve 2 is intact. Now I'm going to go ahead and have you just look at my pen light and just follow it with just your eyes. Alright, cranial nerves 3, 4, and 6 are intact. Now I'm going to go ahead and have you smile for me. Frown, pull out your cheeks, raise your eyebrows. Alright, cranial nerves 5 and 7 are intact. Now I'm going to go ahead and have you open your mouth for me. Alright, take out your tongue, say ah, alright. Could you swallow? Alright, mucus was pink and moist. Mucous membranes were pink and moist, tongue and uvula midline, and dental hygiene was adequate. Cranial nerves 9, 10, and 12 are intact. Now I'm going to go ahead and assess your nose. So just look up for me. Alright. And could you sniff? No deviations were seen in the nose. No redness, swelling, no discharge. Nasal patency was good. Now I'm going to go ahead and assess your ears. Okay. No redness, swelling, discharge, no excess serum in each ear. If you could just close your eyes for me and tell me where you hear the sound.
Right. Left.
Alright. Cranial nerve 8 is intact. I'm going to have you shrug your shoulders. Turn your head into my hand. Turn your head into my hand. Cranial nerve 11 is intact. Just going to assess your respiratory rate. Respiratory rate is 16. Rhythm is normal. No adventitious muscles are used. No cough. Now I'm going to go ahead and have you stand up for me. I'm going to go ahead and listen to your breath sounds. Alright, and if you could just turn for me and just continue to breathe normally. Alright, and lift up your arms. Alright, turn for me. Alright, breath sounds were clear, normal. I'm going to go ahead and assess your spine. Spine is straight, good alignment. Now, if I'm going to assess your CVA tenderness, just let me know if you feel any pain.
No. No.
Alright, and breathe. Thoracic expansion is equal. Now I'm going to have you turn around all the way. We're going to assess your lymph nodes. Starting with preauricular, postauricular, occipital, submental, submandibular, tonsillar, anterior cervical, posterior cervical, and supraclavicular. All the lymph nodes were non-palpable, which is positive results. So if you could just sit down again for me. Stay back up, I apologize. Excuse me. And I'm gonna assess your heart sounds. Starting with the aortic valve at the second intercostal space, right sternal border, over to your pulmonic valve at the second intercostal space, left sternal border, down to your Erb's points at the left intercostal, or the third intercostal space, left sternal border, down to your tricuspid valve at the fourth intercostal space, left sternal border, over to your mitral valve, which is at the fifth intercostal space at the mid-clavicular line. Heart sounds were normal. S1 and S2 sounds were heard in all quadrants. Now I'm going to go ahead and have you stay there. All right. I'm going to go ahead and assess your extremities now, starting with your arms. Okay, any edema or any pain? No edema is noted either in both extremities. Temperature is good. I'm gonna go ahead and assess your legs. Any pain?
No.
All right, temperature is good. Now I'm gonna go ahead and assess all the pulses, starting with your carotid, one at a time. So carotid is here, down to your brachials, which are here. Brachials, radials. I'm going to go ahead and have you turn around for me. Down to your popliteals, down to your, back to your posterior tibials, and turn back around for me. Down to your dorsal pedis. Okay, I'm gonna have you lay down for me. I'm gonna go ahead and assess your bowel sounds. Patient is supine, abdomen is flat. I can tell by this that his thoracic cage is AP to transverse 1:2 ratio. I'm gonna go ahead and start by asking you how your bowel movements have been. When's the last time you had a bowel movement?
An hour ago.
Why is the phone upside down? Okay.
Sorry.
I'm gonna ask you for your bowel movements. What was the last bowel movement you had?
An hour ago.
Okay, and how was it?
Normal.
Okay, no pain?
No.
Alright, how about urinary frequency?
Normal.
Normal? No pain, no smelling?
Nope.
Nothing weird? Alright. Starting with the right lower quadrant, I'm going to go ahead and listen to your bowel sounds. To your right upper quadrant, over to your left upper quadrant, down to your left lower quadrant. Bowel sounds are present in all four quadrants. I'm going to go ahead and palpate for anything. If you feel any pain, just let me know, okay?
Yep. No pain at all. Nope. Nope.
All right.
Nope.
Now I'm going to go ahead and have you sit back up for me. All right. We're going to go back to your extremities. I didn't want to overload you there. Now if you could just put your arms out just like this and push up, push down, push up, push down, push up, push down. Perfect. Strengthen all of your extremities were normal. I'm going to go ahead and reassess your pulses because I forgot to see if they were equal. So let's go ahead and do that. I apologize, sir. All right, carotid, brachial, radial, popliteal, posterior, tibial, dorsal pedis. All right, all pulses were strength +2 and equal. Sorry about that, I forgot I need that for charting. Now back to your extremities. Your extremities were again all normal. Strength was equal in all of your quadrants, or all of your extremities. Now I'm gonna go ahead and have you stand up for me. We're gonna do a little exercise. So if you could just walk normally toward me. All right, gate's good. Now when you turn around, I'm gonna have you flare your arms like this, do your legs. All right, go ahead and turn around and walk back. Perfect. All right. Now I'm gonna have you close your eyes for me. Alright, go ahead and open. Robert test is negative. Yeah, I'm gonna have you sit down. Are you in a comfortable position now, sir?
Yeah.
Alright, I'm gonna go ahead and perform some hand hygiene and I'm gonna go check this. When I forget.